To ramp up really takes a shift in resources and capabilities. We're looking at doing that. We can do that. That's how we will be able to deliver the 2 million doses. But really, we really need orders before we can move.
The CEO of Bavarian Nordic there on plans to ramp up production of the only Mpox jab approved by both U.S. and European regulators. Meanwhile, African manufacturers are also preparing to make Mpox shots. The BioVac Institute, a South African vaccine maker, is able to produce the jabs and is waiting for more discussions with companies, including Bavarian Nordic.
The two manufacturers of Mpox, do they have sufficient capacity to manufacture for the next coming years? So there's 10 million doses that's been spoken about publicly. And so are those manufacturers able to meet the world's current demand? If they are, then it means that they may not need an African manufacturer. However, if we think that they are either unable or unwilling, then that's where I think the likes of ourselves can come in. But what we would like to understand is that will there be an annual demand of the vaccine? Now, that annual demand can come in two forms. Either there can be an annual demand that says that we'll produce the vaccine, BioVac, and we know the arms that it will go into, and they'll have some preventive program, or produce the vaccine and for stockpiling. Now, if there's a long-term stockpiling effort, and we know that there's a predictable demand from a stockpiling perspective, that can potentially make it more viable.
BioVac CEO Marina Maguana speaking to Bloomberg on the viability of an Mpox vaccine made in Africa. In the meantime, the DRC is set to deploy vaccines this weekend that were delivered by the European Commission's Health Emergency Unit. For more details, Janice Kew, our healthcare reporter in Johannesburg, joins us now. Well, Janice, it seems like it's taken longer than hoped for these vaccines to arrive in Congo. Why is that? Why the delay?
Joumanna, sourcing vaccines is a complicated process. First, you have to actually find out where they are and who's manufacturing them and if they've got the quantities you need. But then you've got to fund them, and you've also got to have a really solid plan of ensuring that once they've hit the ground, you can actually get the shots into arms. This might require some extra medical training because different shots are delivered in different ways. It's also ensuring that there's the cold chain that's needed to make sure that the vaccines are kept safe and effective. And you've got to really engage in community, with the communities involved. You've got to make sure that they're comfortable with coming in to get these shots. So it's not a simple process, but it has taken longer. Arguably, Africa should have had these vaccines back in 23 when, or even 22, when the last Mpox outbreak was declared a public health emergency.
Not enough attention was paid at the time. But now that the vaccines are arriving, are we likely to see the outbreak get under control?
It should certainly help. The World Health Organization Director General this week said, though, that vaccines alone aren't going to solve the issue. The World Health Organization and Africa CDC today will release a response plan that will tackle things like weak surveillance and making sure that there is good clinical and home care, addressing some of these bigger issues. And that is really what's going to control things. I mean, back in 2022 and 23, with the less virulent strain that was circulating globally at that time, things really turned around when communities were engaged and they figured out what the main modes of transmission were, what was causing the spread, and when the community came in and changed behavior. So all of these things are going to be necessary. It's not the vaccines alone.
And what are some of the longer-term, say, bigger issues that are also being considered in terms of this vaccine deployment?
One of the big things is going to be price. This vaccine is not cheap. At about $141 a dose, if you were to vaccinate 5 million people in the Congo, you're looking at about $1 billion. And that is not something many countries in Africa can afford. It is supply and demand issue as well. So one of the other conversations that are going to be needed to be had is what is the vaccine strategy longer term? You know, are Mpox vaccines going to become part of routine vaccination programs? That would secure demand. And as we heard from BioVac, you know, when we get demand secured, then these issues can be considered in a more robust way, funding to make sure that there is local manufacturing. These are issues that were raised during COVID and are still very relevant for a multitude of health issues on the continent. You know, these countries are having to make really tough decisions about trade-offs at a price of about $141 a dose, and this is a 2-dose vaccination program. You know, you've got to ask questions. Are you still going to be able to cover things like malaria and cholera and meningitis? The DRC is not just dealing with an Mpox outbreak; they are dealing with an extremely big problem with cholera. 23,500 cases this year alone of cholera in the DRC. So these are tough questions that have to be asked.